Hi, I'm Jane Kim. I'm a pediatric endocrinologist and diabetes research scientist at UC San Diego. As a diabetes doctor, I care for children with type 1 diabetes and help their families manage their care. And I want to gain insight into why type 1 diabetes develops and how it progresses so that I can better tailor effective treatment for each child that I see. My goal is to build a comprehensive clinical database and biorepository of samples from children with diabetes that can be used to answer broad research questions and develop novel therapies for this disease. The first intended use of the database and specific goal of this project is to identify subtypes of type 1 diabetes. In effect, we want to know what type of type 1 diabetes each child has. Some of you may know that type 1 diabetes is classified as an autoimmune disease where the immune system attacks insulin-producing cells in the pancreas, and this is true. But the singular definition belies the fact that type 1 diabetes represents a very diverse group of individuals, and there may be, in fact, several subtypes of type 1 diabetes. And by knowing these subtypes, we can better tailor treatment for each child to make it easier for them to manage their diabetes and to prevent complications. In recent years, there have been amazing advances in our ability to gather and store genetic and metabolite information, as well as in our ability to interpret and analyze these vast amounts of data. My intention is to bring these new technologies to the clinical setting for our patients. The goal of this project is to integrate comprehensive clinical, metabolite, microbiome, and genomic information using newly developed computational techniques that can help us identify these subtypes. And if successful, we'd like to bring this approach to other pediatric diabetes centers in order to improve our clinical practice. We'd also like to make this database available to other researchers so that it can benefit a multitude of projects moving forward to bring us closer to a cure. So these goals are ambitious, but I think we can succeed. However, none of this will be possible without the generous support of donors like you. So thank you so much for listening. Your support is greatly needed and much appreciated. Thank you again.